class. And so we stopped with the instructions to the listening task. And so you have this table with the names of the patients, Mr. Jones, Miss Rigby, and Mr. Dixon. Can you see the slide? Hello?
Yes, teacher. We can see.
Yes.
Okay. Now I'm going to turn the recording on, and we'll listen to the doctor describing these patients, and please complete the table just about each patient now.
Unit 9.
Can you see, can you hear
Yes.
Okay.
Listening. 1.
Mr. Jones had the appearance of self-neglect. He did not appear to be paying attention to what was being said. He looked as if he had withdrawn completely from his surroundings and was preoccupied with his own thoughts, with no eye contact whatsoever. He sat hugging himself during the interview. He did not interact much with the nurse, nor look at anyone else. He left me feeling in quite a low mood myself.
2.
Although Miss Rigby is in her late 40s, she wears really bright clothes, which are suitable for someone much younger. When she was admitted, she was in a highly elevated mood, hyperactive, and was awake all night. Her thoughts are all over the place. She did not appear to be aware of anything abnormal in her behaviour.
3.
Mr. Dixon was well dressed, but looked very worried and anxious. He sat on the edge of the chair, was quite agitated, and couldn't sit still. He was fidgeting all the time and had very poor concentration, though he looked at me when he spoke and was spoken to. I felt safe with him, but a bit nervous after the interview.
And now for the second time.
Unit 9. Listening. 1.
Mr. Jones had the appearance of self-neglect. He did not appear to be paying attention to what was being said. He looked as if he had withdrawn completely from his surroundings and was preoccupied with his own thoughts, with no eye contact whatsoever. He sat hugging himself during the interview. He did not interact much with the nurse, nor look at anyone else. He left me feeling in quite a low mood myself.
2.
Although Miss Rigby is in her late 40s, she wears really bright clothes, which are suitable for some much younger. When she was admitted, she was in a highly elevated mood, hyperactive, and was awake all night. Her thoughts are all over the place. She did not appear to be aware of anything abnormal in her behaviour.
3.
Mr. Dixon was well dressed, but looked very worried and anxious. He sat on the edge of the chair, was quite agitated, and couldn't sit still. He was fidgeting all the time and had very poor concentration, though he looked at me when he spoke and was spoken to. I felt safe with him, but a bit nervous after the interview.
Okay, so what do we remember about these three patients, about Mr. Jones. Who would like to speak about Mr. Jones, please? Any volunteers?
Hello.
So you are, your name?
Yahya.
Yahya, please. Mhm.
After appearance, he have a self
Mhm.
drawn.
Neglected. Yes.
I didn't remember.
So he looked like self-neglected. He didn't care about his appearance.
Yes, he didn't look at any place.
Oh.
He didn't interrupt when he after the interviews.
Uh-huh.
He,
Okay. So did he talk to the doctor? Yeah.
Sorry.
Did he talk to the doctor? Did he answer just, did he interact with the doctor?
Yes.
Mm-hmm. And how did he sit? What was his posture? The doctor speaks about this.
When he said
Uh-huh.
he focused on with the doctor
Okay.
and answer the questions. Didn't look at any place at any ways.
How did the doctor feel at the end of the interview? The doctor's feelings. Was the doctor just in a good mood?
Yes, in a good mood.
Actually, he says that in a low mood, yes? Just a little bit unhappy. Mhm. Okay.
So no, Mr. Dixon, who he is in the good mood.
Mr. Jones, yes? You are speaking about Mr. Jones. Mhm.
Yes, Mr. Jones, who he has the low mood, and I interrupted with Mr. Jones and Mr. Dixon.
Mhm. Okay. Yes, and about the posture, the doctor says he was hugging himself, like the posture that shows that he doesn't want anyone to interact with him. Yes, he's closed. He was closed.
Yes.
Okay, thank you. Now about Miss Rigby. Who would like to speak about Miss Rigby?
Can I?
Your name?
Yeah.
Yeah, it's enough for you. What about the other students?
Okay.
Yes, I can.
Your name?
Buse.
Buse, please.
For Miss Rigby, he's like a young and he's wear like exaggerations for very stable the exaggerations clothes. It's also have the bright and more stable the clothes, and it's wears weird.
I see. You say about her age?
Yes, age. It's I think she said younger. For clothes.
Yes, she wears the clothes who are normally worn by young people, but actually she is in her 40s. So the doctor says these clothes are suitable for someone much younger than Miss Rigby, actually.
Yes.
Okay. And what about her manner? How did she behave?
She have like she was the 14, but she act like a big young lady. She
Okay.
acts not like same the age. She is
Yes.
acting like big, not the like her young. Sorry.
Mhm. And was she like sad or aggressive or active or
Active.
active? She was very
Yes. Very active.
hyperactive, the doctor says. Mhm. Did she
Yes.
understand anything that her behavior is abnormal? Did she understand this?
I think no. She didn't understand.
Yes, the doctor says she didn't understand anything abnormal, that there
Yes.
is anything abnormal in her behavior. Yes. Okay, thank you. Well
Thank you.
done. So now Mr. Dixon, who will speak about him? Yes? No volunteers? Mustafa, are you here?
Yes, doctor.
So please, what do you remember about Mr. Dixon?
Actually, the voice was loud and I didn't listen.
Can I?
Your
My
name?
name is Yahya.
Yahya. Okay, Yahya, please.
Well dressed,
Mhm.
very spoken with a doctor. He is nervous.
Mhm. Mhm.
Uh,
Mhm.
he also
So you means he was ready to speak to the doctor, yes? So there was eye contact between Mr. Dixon and the doctor, right? Mhm. Yes, and how did the doctor feel at the end of the interview?
nervous.
Nervous, yes, safe, but nervous. The doctor didn't afraid of Mr. Dixon, but this nervousness transferred to the doctor. Yes, and if we speak about their, yes, thank you. If we speak about their diagnosis,
Unit 9.
what
Listening.
kind of diagnosis can we think of? What is likely diagnosis in each case? Like when Mr. Jones, his appearance was, he was careless about his appearance. He didn't have eye contact, just didn't pay attention, was withdrawn. And the doctor just was in low mood after his interview. What is the most likely diagnosis? Is it, if we speak about these disorders, like, is it mania, depression, anxiety, or psychosis? What do you think? Hello? Tala? Is Tala here?
Yes, teacher, but I'm sorry, I am entered to the meeting late, so I didn't listen to the cases.
I see, but okay. Who can speak about the diagnosis? Dilara, what do you think of his diagnosis, of Mr. Jones? Dilara, hello.
Yes.
Mhm.
Maybe he is depression.
Yes, this is depression, just the obvious the signs of depression: carelessness, no eye contact, like very low mood, and so on. Miss Rigby, so what's her diagnosis? Elevated mood, just hyperactive. Businur, please.
Yeah, I think she is like a mania.
Yes, her diagnosis is mania, right? And Mr. Dixon, like he's well dressed, but nervous, and just sits on the edge of his chair. What's his diagnosis? Mania, depression, anxiety, or psychosis? What is it? Actually, this is anxiety, yes? So anxiety. Well, if we move to the next slide. So let's try to do this. Yes, this is written about Dr. Turner, no. So we'll miss this, and let's focus on some grammar aspect, language part. Actually, so when people describe some past events, they normally use the tense which is called the past simple tense. And but sometimes when we need to show which action happened first and then which followed this action happened later, we can use the past perfect tense. So in this sentence, which is given here on the slide, I had chosen a period in accident and emergency for my next undergraduate rotation when an opportunity to work on a psychiatric ward came up. So there are two tenses here just used in this sentence. The first one, had chosen. This is the past perfect tense, you know, the form of the past perfect. And then came up. This is the past simple tense. So, and what do they show if they are given in one and the same sentence? They show both actions are in the past, but the action which is expressed with the help of the past perfect tense happened earlier. First, he had chosen something in his life, and then the opportunity to work in psychiatry came up to him. So, and he emphasizes that it's important for him that it was his choice, not just an accident. And like the second sentence is, it wasn't something I had planned for a long time. Another sentence also wasn't, this is the past simple, and had planned the past perfect tense. And so the person speaks about something that was in the past, but he had planned, this planning happened before it happened. So the rule, we should use the past simple and the past perfect to describe an event or period which happened before a point or period in the past. And so this is the form of the past perfect tense. So it is formed with the help of the auxiliary verb had plus past participle. When do we use the past perfect tense? The past perfect takes place before another past action, like in the sentence, I noticed that he had left his books behind. So first he had left the books, then I noticed it. So both actions are in the past, but leaving the books happened earlier. If we look at the timeline here, like on this slide, so it shows that both actions were in the past, but the action which is described with the help of the past perfect happened first, earlier than the action expressed with the verb in the past simple tense. Is it clear?
Yes.
Okay, good. Now we can look at this slide with the sentences, and you can see that there are two actually gaps in each sentence, and we should decide which tense to use these verbs. I mean, one of them should be used in the past simple and another in the past perfect tense. Well, let us have a look at the first sentence and listen to, let us say, Mohammed Nabil, please. Read the first sentence. Mohammed, Nabil, are you here? No, minus. So, Tala, please.
The Dr. Glover already his word around round when the conclusions about we have to change the telephone. Yes.
Consultant. We need to understand which action happened first, finish or telephone.
Finish.
Yes, so that is why we need to use this verb in the past perfect tense and telephone in the past simple.
Yes.
So
in finish it will be had finished. Have.
Had, right. Dr. Glover had already finished his word rounds when the consultant
had also.
No. What's the past form of telephone? This is the verb to telephone. What's the past simple of telephone?
Telephone.
Telephoned. Yes, when the consultant telephoned. Yes. Had already finished. Telephoned. The second sentence, please. Let's listen to Yosif.
The second one. The doctor rushed to the ward, but the patient already disappeared.
Okay. Imagine the situation. The doctor rushes to the ward, like comes to the ward. And what does he see? There's no patient. Patient.
He will be nervous and.
I mean, which tense should we use? Which happened first? Rush or disappear? Which action happened?
Disappear.
Disappear. So use disappear in the past perfect and use rush in the past simple, please. The doctor.
The doctor rushed.
Yes.
To the ward, but the patient already disappeared. Had disappeared. Had disappeared.
Yes, had already disappeared. Okay, good. So, Shema, are you here? Sentence number 3 is for you, please.
Yes, I'm here. I did some assessment tests before, so I know what to do.
It should be in the past. This person.
I knew what to do.
And which verb should be in the past perfect tense?
I have done.
Yes, I had done. Assessment. So I knew what to do. Good. So Dilara, please.
Yes, doctor.
4, number 4.
Yes, 4. Mr. Scott be well known to the police. They arrest her once before and bring her to the hospital. I think B was Mr. Scott was well known to the police, and they had arrested her once before and had brought
her to the hospital.
Yes.
Okay. Yes. Or just had arrested and brought her. Yes. Good. Thank you, Dilara. Now, Bire, sentence number 5. Bire?
Yes. You make up your mind about your future charger when you be at secondary school?
Mhm.
Had you made up we were?
Your mind. So there are two verbs, make and be. Yes. Like be
Yes.
in a
Had you
secondary.
made up and we were? Were.
I think it's vice versa. Like make should be used in the past simple, and be in the past perfect. Sorry. Had you made up your mind about your future career when you were okay? When you were,
Had you made up?
I think, did you make up your mind when you had been at secondary school? Yes, because being in secondary school is just he first went to secondary school, then he made his mind about his future career. So it's better to say, did you make up your mind when you had been at secondary school, like this? Okay, Esginur, the next sentence, please.
Yes, he hadn't completed his internship by the time he left his home country.
Exactly, yes. But he hadn't completed, yes? Mhm. Perfect, good. Businur, are you here?
Yes,
Mhm.
yes, I'm here. I'm here. In 1960, a year after Roche, blah blah, diazepam, Roche along with Merck and Lundbeck, blah blah, amitriptyline to the market.
Mhm.
First, the had first synthesis. How can I say the synthesis?
Synthesize.
Synthesize.
Mhm.
Synthesize. Thank you. Had first synthesize. And introduce also be the past simple, like introduced, ed should be.
Okay, introduce.
Come.
You're
Yes.
right. But about synthesize, it should be in the past perfect tense.
Yes, past perfect tense, had, sorry, not had first synthesize.
Exactly. Mhm. Right. Okay. And so now we are going to speak about how to deal with the people with mental disorders, how to elicit the history. Mhm. So I mean that just one of the ways of diagnosing these diseases is like looking at the just appearance of these people, and also we need to talk to them, and this is some strategies, some instructions how to deal with the people with mental disorders. Just let us read this and just the first part, and let's listen to Jiren.
Okay. Introduce yourself, explain to the patient how long the interview will take, and explain its purpose. Find out how the patient came to be referred and what his expectations are. If the patient then is having any problem or is reluctant to start talking about himself, do not hurry him. Try asking, how are you? What has been happening to you? What are the most important things? Another approach for hospital patients is to indicate why the GP referred the patient and then ask what the patient think about this. Sit back and listen without interrupting. Nothing exact examples of what the patient is saying. Take more control after about 3 minutes to cover the following topics.
Mhm. You see that the main strategy in the interview, in the conversation with the mental disorders, people with mental disorders, is like patience, yes? Allowing the patients to speak about themselves. And so at the beginning, you should explain the purpose of this interview, of this conversation, and the patient's expectations, what from this interview. Okay, and so the doctor should make some notes about the condition and listen. And so this is very important. And don't judge the patient. Don't just tell about any diagnosis, just making notes, and that's it. Okay, the next piece of information is about presenting symptoms. And let us listen to Yahya, please. Read it.
I'm sorry, I have a problem with my A, so I couldn't read anything. I haven't.
Can you see the slide, Yahya?
Yes, I see, but
what's the problem?
The problem was me.
Oh, I see. Okay, just listen then.
I'm sorry.
Let's listen to Mustafa. Mustafa,
Yes,
hello.
doctor.
Yeah, read
Yes,
it.
Presenting symptoms, agree problems list with the patient early and be sure it is comprehends, for example, by asking if we were able to deal with all this, what things then be all right. Or if I were to help you, how you things be different, then take each problems in turn and find out about is honest, the duration, the effect on patient's life, and the family events, considering which the honest, the solution tried. Reasons why they failed. The next step is to inquire reasons why they about moods and beliefs during the last weeks. This is different from the mental state examination, which refers to mental state at the time of interview.
Yes. You can see that it's interesting that when the doctor writes the problems, he shows this list of problems to the patient, and they should agree that the patient really has these problems. And so be sure it is comprehensive. Comprehensive here means easy to understand, means that the patient understands his or her problems. Then there is a word like onset, yeah? So find out about the onset. Onset, I guess you remember, this is the start, the beginning of something, the beginning of this condition in this case. Duration, how long it lasts. Then events coinciding with the onset. Coincide means happening at the same time. This is the meaning of coincide in this context. It means that which events are connected with the beginning of this condition. Maybe they were triggers or just associated with this condition. Which solutions tried? Which treatment did the person try for his condition? Why this treatment failed? Okay. And the next piece of information. It's very important when psychiatrists talk to their patients to check for these three just dangerous conditions. Now let us listen to Mohamed Nabil. Mohamed Nabil is absent. Tala, will you read it?
Okay. A specific check for suicidal thoughts, plan, or actions that more specific there are greater and dangerous. Discussion, suicide does not increasing the dangerous. Desperation, low mood, anhedonia, unable to feel pleasure, self dangerous. It will be I am otherless, or I wish I had not been born. Glued, it's my fault. Look interested hobbies and friend plus biological markers about depression, early morning waking, discreet, abated and sexual activity, and weight loss, and mania, symptoms of physiological and logical behavioral delusion about hallucinations like drug and school and alcohol use, and oppositional thoughts and anxiety and eating disorders. Example, young women often vulnerable and important, not compulsive behavior. Example, exclusive hand washing.
So the doctor should check whether the person wants to commit suicide, means kill himself. So whether the person has depression, like the description of depression, and any symptoms of mania or psychosis. Well, it's like very interesting just sphere of medicine, psychiatry, and I know that there are some students who are eager to be psychiatrists in their future. Well, that is all